Hi everybody, welcome to It's a Guy Thing, a men's health presentation from the National Institute for Fitness and Sport. My name is Tim, I'm a fitness manager with NIFS. I live in Brentwood, Tennessee. It's my pleasure to bring you through this men's health presentation today. June is National Men's Health Month. As part of that month, National Men's Health Week is from June 11th to June 17th this year. Anchored by a Congressional Health and Education program, Men's Health Week is celebrated with health screenings and fairs, as well as media appearances all over the country. Another event is Wear Blue Day on June 19th. This is a way for you to show support for men and boys in your life simply by wearing blue. You can register to participate in a National Wear Blue event at menshealthnetwork.org/wearblue. The purpose of Men's Health Month is to heighten the awareness of preventable health problems and encourage early detection and treatment of disease among men and boys. This month gives healthcare providers, public policymakers, the media, and individuals an opportunity to encourage men and boys to seek regular medical advice and early treatment of disease and injury. This page shows some interesting statistics about men's health. The quote below from Dr. Davis Gramillion of Men's Health Network says, "There's a silent health crisis in America. It's the fact that on average, American men live sicker and die younger than American women." A few of those statistics that stand out include the fact that 1 in 2 men will develop some form of cancer in their lifetime. And unfortunately, over 30,000 men will die from prostate cancer in America each year. Here are a few more health facts about men's health. Men die at higher rates than women from the top 10 causes of death in the United States and are victims of 92% of workplace deaths. Looking at the chart, you can see a few of the top causes of deaths in the United States, and men take the lead on those causes of death. All of these statistics indicate an issue with men's health in the United States. Let's take a minute and look at cardiovascular disease. Heart disease is the #1 killer in America for both men and women. But for men, it's responsible for about 1 in 4 deaths. The average age for the first heart attack is 64.7 years old for men. High blood pressure, high blood cholesterol, and smoking are key factors in heart disease. About half of Americans have at least one of these risk factors. Here are a few more risk factors for cardiovascular disease that men struggle with. There's diabetes, high body weight and obesity, an unhealthy diet, physical inactivity, and excessive alcohol use. A few of those risk factors are modifiable, which means by making changes in your lifestyle, you can affect your level of risk for heart disease. All of the factors I just listed can be modified by making lifestyle changes. There are a few other risk factors for cardiovascular disease that are non-modifiable, meaning there are factors that are outside of our control. These include your sex, family history, your race, and your age. Going right along with cardiovascular disease is stroke. Stroke is the 5th leading cause of death for men in the United States, and stroke is the leading cause of serious long-term disability. Here are a few more risk factors for having a stroke. There's smoking, and about 1 in 6 men smoke right now. Being overweight or obese. About 3/4 of men in the United States are either overweight or obese. About 1 in 8 men have diabetes. And this is a big one. Men are more likely than women to drink too much alcohol. And the last one there, only 1/4 of men in the United States are getting enough physical activity. Stroke kills the same amount of men in the United States each year as prostate cancer and Alzheimer's disease combined. Stroke reduces mobility in more than half of stroke survivors under the age 65. Lung cancer is also a serious men's health issue. Lung cancer is the leading cancer killer for both men and women. About 60% of all new lung cancer diagnoses happen among people who have never smoked or have quit smoking and are former smokers. Fortunately, there is some good news, and since the 1980s, cases of lung cancer have dropped pretty significantly. Here are a few things that put you more at risk for developing lung cancer. The first one that we all know is smoking. Along with that goes secondhand smoke. There's exposure to radon gas, exposure to asbestos and other carcinogens, and a family history of lung cancer. Your risk of lung cancer will increase with the number of cigarettes that you smoke each day and the number of years that you spend smoking. Quitting at any age can significantly reduce your risk for developing lung cancer. Even if you don't smoke, your risk of lung cancer goes up if you're exposed to secondhand smoke. Radon is produced by the natural breakdown of uranium in soil, rock, and water, and that eventually becomes part of the air that you breathe. Unsafe levels of radon can accumulate in any building, including homes. There's also workplace exposure to chemicals known to cause cancer called carcinogens. A few examples of this include arsenic, chromium, and nickel. All of these can increase your risk for developing lung cancer, especially if you're a smoker. Another danger to men's health in the United States is prostate cancer. Second to skin cancer, prostate cancer is the most common cancer among men. At some point in their lives, about 1 in 9 men will be diagnosed with prostate cancer. Prostate cancer is the second leading cause of cancer death for American men, second only to lung cancer. Finding prostate cancer early offers the best hope of living cancer-free for a long time. Factors that put men more at risk for prostate cancer include a family history of prostate cancer, increasing age, nationality, and a high-fat diet. Fortunately, the 5-year survival rate for prostate cancer is almost 100%. Regular exams are key for early detection, which will improve patient outcomes. Even though it may be unreported, diabetes is the 7th leading cause of death in the United States. Most people with diabetes are over the age of 65, and the most common type is type 2 diabetes. About 90% of the men with diabetes have type 2 diabetes. Type 2 diabetes increases your risk for cardiovascular disease and can negatively affect the health of your eyes, your skin, your kidneys, and nervous system. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled as the American population has aged and become more overweight. Risk factors for diabetes include being overweight, being over age 45, having a close family member with type 2 diabetes, or being physically active less than 3 days a week. We've talked about physical health, but there's also a mental health component to men's health. In 2018, men died by suicide about 3.5 times more often than women. For middle-aged men, stressors in life that challenge the traditional male roles, such as unemployment and divorce, increase an individual's risk for suicide. Although many cases go undiagnosed, there are more than 6 million cases of depression in men each year, and there are several risk factors that increase your risk for suicide and depression. These include prior suicide attempts, abuse of alcohol and other drugs, mental disorders, particularly depression, access to lethal means like firearms, knowing somebody who died by suicide, especially if it's a close family member, social isolation, chronic disease and disability, and a lack of access to behavioral health care. According to the National Institute of Mental Health, it's important to help men with depression reduce the risk for suicide by recognizing that society's model of work through it can work against men. They also emphasize that it's important to find help when you're not feeling right and to not be ashamed of it. This graph shows life expectancy by sex from 1920 to 2017. In 1920, the life expectancy gender gap was only 1 year. By 2017, men were dying 5 years sooner than women. And now we ask an important question. Why are men at risk? There are quite a few reasons. One reason is that a higher percentage of men have no access to health care coverage. Men make about half as many preventative trips to the doctor as women do. More men are employed in dangerous occupations like mining and firefighting. Unfortunately, society sometimes discourages healthy behaviors in men. And men usually have less healthy lifestyles. This includes taking more risks at a younger age. The follow-up question is, what can you do? As I mentioned earlier, for many men's health issues, early detection and frequent screenings are essential to have the best outcomes. This means seeing your doctor regularly even when you're not sick. They say an ounce of prevention is worth a pound of cure. When you go to your doctor, talk to them about any physical or emotional changes that you've experienced lately. For any health problems that you do have, it's very important to learn the pros and cons of any treatment options that you might have. Make sure that your doctor knows about any medicines that you're taking, which includes over-the-counter medications and health supplements. Another thing that you can do is learn about health issues that are common for men. These include prostate problems, osteoporosis, diabetes, and Alzheimer's. Find out which screenings you need at your next doctor's appointment. If you're over 50, there are screenings that you need to do each year. These include having your blood pressure taken at a physical exam, a few other blood tests, a rectal exam, and an EKG. One of the most important things for men's health is to stay physically active. Here are a few key takeaways from the most recent guidelines on physical activity. It's very important to move more and sit less throughout the day. Aim for about 150 minutes a week of moderate intensity aerobic exercise. This aerobic activity should be done in bouts of at least 10 minutes. A multi-component program includes multiple components of fitness, like walking, lifting weights, even doing some balance exercises. Ballroom dancing is a great example that combines aerobic and balance training. To enhance balance and prevent falls, those with poor mobility should exercise at least 3 days a week. Muscle strengthening activities should be performed at least 2 days a week. These recommendations don't change just because your age does. Here are a few nutritional needs to be aware of for men's health. If you're between age 50 and 70, you need at least 15 micrograms of vitamin D each day, but not more than 100 micrograms. If you're over age 70, you need at least 20 micrograms of vitamin D each day, but again, not more than 100. You can get vitamin D from fatty fish, fish oils, fortified milk and milk products, and some breakfast cereals. For vitamin B12, you need 2.4 micrograms each day. You can get this vitamin from fish, meat, milk, and some fortified breakfast cereals. Some people over age 50 may have difficulty absorbing vitamin B12 from food sources. These people may need to take a vitamin B12 supplement or focus on or eat more fortified foods. For calcium, men aged 51 to 70 need about 1,000 milligrams per day. For men over 71, that number goes up to about 1,200 milligrams. Don't exceed 2,000 milligrams per day. Calcium is a very important mineral for bone and teeth health. You can get calcium from milk and other dairy sources, also tofu, leafy green vegetables, salmon, soybeans, and calcium fortified foods. For magnesium, men and women's needs are a little bit different. Women aged 51 and over need about 320 milligrams of magnesium each day. For men, that number goes up to 420. Magnesium is usually found in foods with a higher fiber content, like leafy green vegetables, whole grains, and legumes. There are also breakfast cereals that are fortified with magnesium. There may also be magnesium in the water that you drink. Moving on to potassium. For people over age 51, about 4,700 milligrams per day is adequate. Many different fruits, vegetables, meats, and dairy foods contain potassium. Some foods that are particularly high in potassium include apricots, lentils, and potatoes. Adults get a lot of their potassium from milk, coffee, tea, and other non-alcoholic beverages. It's very important to have a healthy eating game plan and to keep track of it. Aim to eat breakfast every day, eat at least one fruit and vegetable at each meal, consume the rainbow, meaning consume a variety of colors of foods, and less is more when it comes to the number of ingredients in your food. It's time to stop the supersizing and focus on consuming more whole grain foods every day. Here are a few things to avoid for men's health. Sugar-sweetened drinks and food, foods made with solid fats like butter, lard, and margarine, foods high in added fat like butter and lard, and salt. There are also some indications to limit the amount of red meat that you consume. I'm going to pause for a minute at this slide so that you can write down some of these resources that we used for this presentation today. Thank you so much for spending a little part of your day with me today learning about men's health. Remember that Men's Health Month is in June and Men's Health Week is from June 11th to the 17th. So pay attention around that time and find a men's health event near you. Thank you, everybody. We'll see you in the next video.